Dr. Danielpour works about 2 blocks over from me. We're all neighbors in Beverly Hills, which is the coolest thing. And unfortunately, we don't get to see each other. Every time I see you, I'm like, I can't believe I never see you because I feel like we should be hanging out all the time. So it's a sad shock. And then now we're all kind of stuck at home, but not for long. And before everybody gets back to their life and going back to trying to become amazing and beautiful and all that stuff that we like to help out with, we both thought actually it's a great idea to do a show on how to really find that person, how to find that surgeon, because everybody is so lost. I try to explain to patients too when I'm doing a consult why this is so important. I myself am, a facial plastic surgeon, and before I knew who was good and really figured out how to sift through things, it took me about 4 years of med school, 5 years of residency, 2 fellowships, and then 2 years into practice and multiple international meetings before I really figured out like, oh my God, it's not that person who's good. That's just media. It's not that person who's good. That's just because he runs a fellowship. It's actually like that guy who's good. And it's really weird because for us, we like have to really fall back and pull away from looking at academia as like the number one place where we find, the vetted surgeon. So we'll call this episode How to Vet Your Surgeon.
I like that. I like it.
Yeah. So I would say, we've both gone through this where we try to explain to patients our frustrations with bad work we've seen out there and bad advertising and all this other stuff. Most patients say, oh, well, I checked and the guy's board certified. Okay, so at the basic level, I'll have you explain your thoughts on this, but we have medical school, right, gives you a medical degree. You're still not a good plastic surgeon, right? Okay, then we go through residency, which could be residency and fellowship. At that point, you can become a plastic surgeon. Still doesn't make you a good plastic surgeon. Alternatively, there's doctors who don't even do that, and they go start doing plastic surgery. So you see how bad it can get. And then there's people who do even another fellowship, and now at least they've gotten a good amount of like exposure to it, but still not necessarily a good plastic surgeon. So can you tell me how you like walk patients through understanding training and board certification before we talk about like experience even?
Absolutely. Everyone asks when they talk to you, when they're friends, forget about even patients. They say, how long did it take you to get to where you are? Mm-hmm. And I break it down normally and they're like, what? It took that many years? And it does. It takes a long time. And that's
They've asked me, I've actually had the same question, but I was on my knees crying on the ground and they're asking me like, how many years did it take you to get like this? But you're talking about like success in medicine.
Exactly.
Yeah.
No, but it's funny because you talk to someone who's, you've got a lot of buddies who are hedge fund managers or in banking or whatever. So they compare their road to your road. And I'm not going to get into that whole spiel, but so you do 4 years of med school and there's multiple different ways to become a plastic surgeon. I did it the traditional old-fashioned way because I did general plastics and I did 5 years of general surgery where I became a general surgeon. So I could take your gallbladder out, I could take your colon out, I could take your pancreas out. And then I did 2 years of plastic surgery. I was lucky enough to train in a place where I had my own cosmetic clinic. So I did so many cosmetic cases that when I came out, I felt comfortable taking on pretty much all the cosmetic cases that I was going to do. And my reconstruction load was very high. So I felt very comfortable in doing it. So I just came in and I went into private practice. Mm-hmm. The beauty of my practice or our practice is I trained with my partner. So we did everything together. So when we came into practice, it was just kind of taking over from training. For people like you who did med school and then did ENT and then did facial plastics and then did 2 other residence or fellowships, people don't quite understand the amount of time it takes to apply for each program, how hard it is to get into each program. Most of these programs that, for example, you got into, and I'm just going to bring you up right now because we're talking, maybe 10% of the population gets into these programs. People don't realize there are hundreds and hundreds of applicants, sometimes even thousands, and they'll pick one person.
Yeah, and you can't sleep your way to the top. It's all guys. Just exactly. In case. Yeah, I've tried. There's no extra incentive you can throw in there, unfortunately.
No, it's true. And so then you come out into the real world after you do all this training, and there's really a couple different routes. And the routes are go into private practice like you and I did, after the fellowship training and whatnot, go and join a practice that's already up and running, a group practice, or join an academic practice, go into an academic center and get a salary and work for them. The hardest thing to do is to do what you and I did, to basically just go hang a shingle. And
it's the scariest. Yeah.
Let's do it. Interesting part about it is the competition that you have around you didn't necessarily all do the same type of training. And that's basically what we're here to kind of educate people with. Just because there's an article in Vogue that says Dr. X is the best facial plastic surgeon / dermatologist injector specialist of the world, doesn't mean anything. And that's the thing. You have to realize that a lot of these articles are paid for. They're run by PR. These things aren't legit. And unfortunately, people go, they spend a ton of money with those people, and then they come and sit in your table or your chair and say, I just spent this much money. Can you fix it for me? It's hard to turn around and be like, oh, why did you go to that person? It's because it's sitting right in front of your face. You're getting all the advertisements. You're getting everything. All of the smoke and mirrors and all the photoshopped pictures on Instagram or websites or whatever are there. And unfortunately, there's no governing body to really stop them.
Yeah.
Now, if you did that, you'd have to actually answer to someone.
Yeah. So I busted my ass many years, and I've got, 2 board certifications, which one's enough, right? And 2 is just because I went through this path and I went through that path. Like you had general surgery, so you'll have general and then you'll have plastic, so people understand. I've met people with 5 board certifications. So feeling pretty damn bad about myself. And I'm like, dude, how'd you get number 3, 4, and 5? Where'd you get the first 2? And so is there a difference between the boards? Like, so how do people understand what a good board is versus a bad board? I mean, there's a board that is legit, right? There's the ACGME controlled boards of the American Society of Plastic Surgery. There's the ACGME board of head and neck surgery, but non-ACGME of facial plastics, right? So how do people find out, like, how do you tell them? Because it's so hard to explain to people, like, yes, they have a board certification.
It's a great question.
And it was a weekend course and $500. Like,
it's true. I mean, you could do a weekend course in liposuction and do liposuction and get it from the American Academy of Cosmetic Surgery, and you're board certified by the American Academy of Cosmetic Surgery.
What is that? Because I've heard of it, and
I still don't know. I got a letter in the mail asking me if I wanted to be a part of it, and I just no thanks. But I think you can check that. I think on a couple different websites, the American Board of Medical Examiners, and you can just go to plasticsurgery.org. That's one of the best places to go. It'll basically, you can look up your surgeon's name and it'll tell you if they're board certified or not. I think it's important because of the fact that if you even understood what we had to go through to pass these boards, now the written is the written. You learn, you memorize, you regurgitate, and you go on. But our oral boards are quite an experience, to say the least. You have to gather up the information, you have to put it together, you have to submit it. Then they have to say it's okay. Then you go to a different place, sit there like they're going to take you execution style, and literally ask you questions that you don't. I mean, you're literally just, your heart's beating out of your chest, and you're saying, "Please, God, I hope I did enough to pass."
Yeah. And I would say for people to understand about the importance of the board certification, because you clearly see there's such a difference in talent between surgeons. So forgetting talent, what's a board certification getting you? You go through all this training of general surgery, which is important because you're learning a lot. Just like I learned a lot in head and neck cancer, and a lot in you learn a lot in that, and then you go through the actual aesthetic portion, the reconstructive portion. But I would say to most people, just so you understand, when you get board certification, you are buying from somebody, you're getting from them guaranteed the bare minimum, and the bare minimum is safety. So you're getting safety because somebody who did has board certified training in plastic surgery, facial plastics, oculoplastics, they have been trained, number one, in safety, how not to fuck you up, how not to mess you up.
Amen.
That's the number one thing you're getting. So you're not getting the cream of the crop, the top, the best talent in the world. Who knows? You have to find that in other ways. The reason the board certification is important is because somebody is telling you, listen, I've gone through this. I've seen so many things get messed up. I've seen all these complications. I've seen it because I've been exposed to it. Whatever training program I was in, didn't matter if I was with the best of the facelift guy or the best boob or ass lift guy or reconstruction. I got exposure to the bad things that happen, and I am a safer doctor because of it. So you're getting safety out of it.
Very well said. I think that's very important to understand, guys, because to do a breast augmentation, to be really honest with you, is not a very difficult operation. I've done thousands of different operations that are significantly more difficult. However, it's knowing that, God forbid, if something goes wrong with anything you're doing, can you take care of it? During this whole coronavirus pandemic, plastic surgeons that are truly board certified were one of the first ones that were reached, that were called upon. I got an email saying, if we need you, can we call upon you? And it's not because I know how to close a wound or do breast augmentation. It's because I have ICU training. I know how to run an intensive care unit because I lived in one for years. Yeah. Now, is it going to really help during a facelift? But no. But you know how to control blood pressure. You know what a vasovagal response. You know what a carotid. There's so many different things that that just a 1-year internship doesn't teach people, and I think that's very important.
And I would say in the world of cosmetics, especially, you have a lot of arrogance, and it's nice to have people who have gone through training because they're more scared. Like they've gone through all this, they've seen the bad things that happen. So their instinct actually and their reactions to things that happen is very different. We're always scared of things going wrong. That's because we've been properly trained. I'm always scared of shit going wrong, no matter how perfect I think I am. And my technique is so awesome and great. Every single time I'm just thinking, number one, okay, don't mess this up. Don't mess this up. Don't mess that up. A+. That's like you're living out of fear the whole time in medicine, and that's how it should be. People who haven't gone through proper training don't have the fear because they don't know the stuff that can go wrong. They haven't seen the stuff that can go wrong.
Perfect. Exactly what you said is so on the money. I can't even tell you.
Yeah. So how do you even find out if someone's board certified? So first of all, if they say the American Academy of Cosmetic Surgery, and this is so funny because I would have said this regardless of this whole toilet paper thing, but you could take that paper and you can wipe your ass with it.
Absolutely.
Okay. And now you have two reasons to, because we're out of toilet paper everywhere. So you can wipe your ass with that certification. And there are these other boards that don't make any sense. And there are boards that pop up every once in a while, like the hair transplant, board and things like that. Okay. Like, why not? They can talk more about hair transplants than other people, and great, good for them. But legitimately, if patients understand, it's the accredited boards, the real ACGMEs. So you want to look for oculoplastics, facial plastics, and plastics. Plastics is the easiest one to look up because they have an ACGME accredited board with a website and everything's on it. So I'll put up, because people don't understand how to look. The next thing while you're looking for if someone has a board certification is actually check, are these people getting sued a lot? There's
and
a
you
web.
Can see it. It's out there. It's very easy to see if you've been sued or not, and what's happened with the actual lawsuits.
Yeah. So you go on these pages. I took a snapshot of a couple. So you go to the California Medical Board, and the California Medical Board has the license lookup page for doctors. And you can go on there and you can actually find this. The top of it's cut off, but it's actually like it says physician and surgeon license. You click on that, you put the name in, and then you get to this. So it'll say my name, my license number, expiration date, which happens to be like right after your birthday, blah, blah, blah. And then there's more detail. That's where shit gets good. So you used to have to go look all this stuff up in the courts and call the local courts. Now people have to actually report it. So these are all self-reported on the California Medical Board. So anywhere that you see the yellow is good. No information to give, no information to give, no information to meet for anything. So that means no malpractice suits are there. So you have to actually look for that. And then we look, let's see, where do we go? Let's check this guy out. So we got Payman Danielpour. It'll tell you everything about him, his training, his background. And then again, you go through and there's nothing. And then here you go to the next page and it'll actually tell you areas of practice and board certifications. So board certification, American Board of Plastic Surgery. that's telling you where they're board certified. And most of this has been verified by the California Medical Board. So this is real. Okay. And postgraduate training, 7 years of postgraduate training. That means that this guy didn't go do a 2-year little tiny thing. He did 7 years and has 7 years to back him up. So this is number one, I'd say most important for the people who are out there and have no idea what to do or where to look, is you have to go on these websites and find that information. And this is for people who really, I'd say anybody, if you're going to get operated on a big surgery, not just like, okay, I'm going to get an injectable, maybe you don't have to go look for that. But I think it's a good idea to look for that and look to see if they've been sued. There's doctors in Beverly Hills who have like 5 lawsuits, 6 lawsuits that are reported on there. If they're not reported, it's because they were settled, and that's fine. That means like doctors get sued. People try to like sue me every once in a while, and then they're like, okay, we have nothing to sue for. Like they just want money, and it goes away. But these other things don't show up on this. Anything that's unsettled, meaning it was a real bad issue, will be on here. So if somebody has something on there, that's when you should be concerned and really look into it.
And that's a good point, Ben. You can always look up all the surgeons on the California Medical Board. So if they're not board certified by the American Board of Plastic Surgery, you can still see if they're a decent doctor. If you want to just go to Injectables, things like that, that'll truly vet them to a degree as well, to see how many complaints have been brought up for them, things like that.
Yeah, and then beyond that, obviously, we've all seen that word of mouth is nice. That's how things spread around. But somebody saying, "Oh, my friend went to them and had a good experience," it doesn't really always work, as you've seen from our most famous actresses and actors in the world who look weird as shit. They all got recommended to that doctor by somebody. So we're teaching you how to vet yourself. And the cool thing is, actually, now the actors and actresses that reach out to me, they reach out to me directly. It's not through a friend. It's not through anything else. They've been researching.
See, that's awesome.
And they start looking and they're like, yeah, I was going to go to whoever my friend went to. But then somebody I heard like mention your name, and I just went and started looking up photos, and I'm like, holy shit. And I go, yes, that's it. I'm not calling them a genius because they found me, although they're very tasteful, but it's, I'm telling them because you're basing it on photos. So before we even get to photos, let's continue. So you'd say past board certification, past malpractice. How do you gauge training and experience? Because that's pretty damn important.
It's a tough one because, training experience, you can get somebody who went to Harvard.
Yeah.
And who may not be,
I don't trust those guys, but yeah.
Exactly. Who may not be the best surgeon. And I don't want to play this down, but I trained in a place where I got my hands dirty in the sense that I worked a lot. We did a ton of cases. We broke a record for the most cases in New York State for a 2-year period because I kept wanting to do stuff. Because in your training, what's important is the more cases you do, the better, because that's how you get good. And then when you get out in the real world, no one else is holding your hand. So some of these super Ivy League, and again, I'm not trying to put anyone down, but the training is not as good because your boss is doing all the big surgeries and you're just watching. They're just holding your hands. Some of the smaller, more community centers that I had the pleasure of working in, they need you to do the work. You are there doing all the work, and you get your hands dirty and you see actually for yourself, and it builds your confidence to see how good you are. Can I do this out there by myself in private practice? Or am I just going to be just horrible and people are going to have to keep fixing? Because people are out there that don't have the case load that they should prior to getting out on their own.
Nor do they have self-realization. So it makes it
very true. Absolutely. I completely agree with you. Half of that is that. But that's a tough one, Ben. And just to look at where somebody trained really doesn't reveal much.
Right. So then I agree. I say those things you can't really figure out. But as a patient, the thing you can figure out, well, you can see the years, you can see where they trained, who they trained with. If they trained with like 50 famous people, great. But a lot of people name drop too. So it doesn't even make, I visited Dan Baker for a day. I trained with Dan Baker when realistically it's some guy who offered him a hand job in a parking lot, said hi. It's not a real thing. It's not, he didn't really train with the guy.
So name Baker lets you close at the end of his cases. He does the facelift himself.
Yeah. See, so it's fantastic. I'd say the experience, a lot of it comes from put things into context. If somebody has 1,000 photos and they've been working, you're like, okay, this person's been working for 5 years and they have 1,000 photos. That's impressive. Like you're looking at it like this is somebody who's busy. They're obviously doing a lot. So I can trust that the thing that they're promising me is a reproducible result. They didn't just get it once on one person, one friend of mine that I heard of. I'm actually seeing this person do it on 1,000 different people, and everything this person does is natural. That's the best way to kind of vet somebody. And you get a feel for the photos, because people call me, they're like, yeah, those photos were a little weird to me. I'm like, what do you mean? They're like, well, the noses looked exactly the same on the lateral view every single time.
Well, that's good.
And they're like, well, no. They're like, and I'm no Photoshop master, but like, to have that variety of noses that this doctor had, but they're all exactly the same size in the end. And I looked at it, and it was a guy in Beverly Hills, all fucking Photoshopped. Every single lateral view was Photoshopped.
Unacceptable.
But patients get the sense of it after a while. So they kind of like pick up on it. And fortunately, like when you look, but that's the whole thing though, is all I'm saying is look through photos, a lot of them, and be comfortable with it and put it into context. If this is someone who's been operating 50 years and they have like 5 photos from 20 years ago, they're probably not doing a lot of that surgery. So,
and that's important what Ben just said. They're probably not doing a lot of that surgery. Now, we learn a lot of surgery, guys. I learned how to do a facelift. I've done facelifts. I don't do any. No one's coming to me for a facelift, okay? It's just not, because it's not something I do. And I'm not going to try to sell that. It's not my thing. And I think that's sometimes one of the biggest problems is some people think that just because they trained and they did all these things, they should do it all.
It's like, I mean, people saying I know how to do something or I can do something is very different than I'm the fucking best at this thing. Nobody can do it better, or I'm amongst those best. Exactly. And that's how it has to be. If you're not amongst those best and you're not getting the top result, you have to send it to somebody else. Like, you don't just do it yourself.
With you. And listen, and it's very true. Listen, if you have something that, if someone comes to me and I don't, for example, do ectropion repair, I'm going to send them to Guy Masry. You know what I mean? I'm going to send them to the best eye guy in town, because why do I want to deal with that type of, first of all, headache? And second of all, if I know in my heart that I can't fix it, it's probably going to end up in a disaster, and I'm going to have to chase after it and then end up sending that person to someone else after. So I think it's important to know your limitations, and some people just don't, and that's half the problem.
Yeah.
And like you said, and seeing people that have a lot of good results, different types of face, different types of noses, excellent results over and over and over again.
Yeah. And real results. So difference between real results and fake results. Fake results are when somebody takes a photo 2 weeks after a surgery or the day of the surgery, and they're like, this is your result. Or when they take videos of procedures and just show videos, but you're like, dude, this guy has 100 videos, or girl, I don't mean this guy or girl, has 100 videos in the past like 2 weeks, but there's not one before and after, or there's just one before and after that really was taken 3 months later, 6 months later, a year later. You have to look for the results. Who cares about the process?
Okay. Very important what he said.
Yeah.
Results should stand the test of time to a degree. Now, we don't do things that last forever.
Right.
Noses can, and some other things. But I tell people, listen, I do a breast lift on you. Give it 10 to 15 years. We may have to do another lift, but it should last at least 5 to 10 years.
Yeah.
If my results, if I'm putting results up that are 3 months old, that doesn't mean anything. Yeah. And you're right.
It's like somebody gets on one of those home improvement shows and they go and they remodel like 20 houses, and you're like, oh my God, everything they did was so amazing. But then like a little wind comes 2 weeks later and blows the shit down. That's what you want to see. Did it stand that test at least? Did it make it out 3 months, 6 months? So don't fall for the videos that are taken over and over again, because the real volume analysis, I would say, on looking at someone's experience is, and this is the only way I know how to gauge it, is I look, okay, somebody's been in practice like 1 year. Okay. In that 1 year, let's say they have 5 photos, 10 photos, 80 photos. You can pretty much multiply that by like 10 to 50 and get the actual number of cases they're doing, because not everybody lets you use their photos unless you're doing everything for free. So when I look at the videos are not telling me the person's busy. We all can operate 2 a day, 1 a day here and there. The thing that's telling you somebody's busy and doing a lot and getting reproducible results is they have a ton of photos that all get really, really nice results. And it's a lot for the time they've been working. So for 2 years they've been working, they have this much. For 5 years, they've been that much. For 10 years, they have that much. And the real number of patients they've operated on is 100 times that.
Absolutely. And they're their photos.
And they're their photos.
That's the other thing. And I know this is something that I love about you, because you'll call someone out, and it's happened so often.
Yeah, well, it hurts my feelings.
No, it's listen, man, it's plagiarism. If you really
Yeah.
look at it, if for someone to take your work and put it up and say it's theirs, that's completely wrong. But when it's being done in Turkey, what are you going to do? Go after them? Or when it's being done in Germany, it's hard to really go and do anything about half these people, and half the guys don't have any type of board certification or any type of governing body. So you're stuck. You can't do much about it.
Yeah. The photo stealing itself, it's very hard to I was going to start at some point like a web page or an Instagram page where you actually put up all the doctors who stole photos.
That's great. I love it.
And I've been mistaken several times where I got upset because I thought somebody stole a photo and I wasn't as patient as I used to be because so many people have been stealing. I kind of just jumped to that conclusion now. Where I look at it, they're like, "Oh no, I actually just looked at it online. I Googled my people Googled a photo and they just put it as an example. We didn't mean to say it was ours, and they really didn't mean to. They're not like Instagram savvy and copyright savvy, and they're just like, no, I just meant to use it as that," and they apologize. Then there's like total scumbags like this guy in Dubai, and who would post the photo, and then when I contact him, he refuses to respond. He blocks me on this, blocks me on that, and like would never that's not like an ethical doctor. But there's nowhere to go tell people this, to say, hey, watch out for that guy. He steals photos. And if someone steals photos, you can't trust them with cutting your face open and then taking care of you afterwards. Because if they're going to lie to you before the surgery, they'll probably lie to you after the surgery. And we don't want people viewing doctors as though they have the potential to be scumbags, because we're supposed to be next level. We're supposed to be, have higher ethics than everybody else, be held to a higher standard. So we don't want other doctors even seen like that. It makes everybody look bad.
Unfortunately, we're supposed to be exactly at the highest moral and ethical value standards possible. Problem is, people get so caught up with becoming successful or making money, and they're not good. So how are they going to do it? And that's one of their way of it's horrible. And you see it all the time, and it's a shame, but it is what it is, unfortunately. Somebody just wrote down on one of these comments saying, watermark your photos. We watermark them.
I watermark everything.
We watermark everything, guys. They still get taken.
Watermarks are like water. It just comes right off.
Exactly.
It's like they zoom in closer and they do like weird shit, or they Photoshop it out. Then they do all this stuff. But and doctors are supposed to be diplomatic, but I'm not diplomatic. So
it's better that way. Being diplomatic gets you nowhere.
It doesn't. Yeah. I don't have the control.
I'll tell you one thing though, and I think one other thing that's really important, and this is something you do a lot of, which I like. Somebody who lectures about something, somebody who feels very comfortable getting in front of people and speaking about a procedure, in my opinion, is the closest thing to an expert. Okay. And if they're putting up their results the way they do it, their technique, for example, listen, I've been somebody who really didn't like lifts. I thought lifts were, well, what are you doing? Yeah. And I saw some of your stuff and I saw some of your lectures, and listen, they're beautiful. It's excellent.
Thank you.
You've done that procedure and you've done a great job with it. Now, other people will think that it's easy. Literally. Yeah. They'll think it's easy. How hard can it be? Just make an incision here, take a little slit, put it back up. I've seen the complications. They're horrific. And sometimes they're hard to fix.
Oh, they're impossible to fix.
Exactly.
Nose is missing. Yeah, it's very hard to fix.
So, you look at people like Ben, or you look at a guy, and I'll throw out another name like a Gavami, who lectures around the world about BBLs. Listen, he does the best BBL in town. Nobody does a better BBL. I'll tell them to their face. And if you're going to write the articles, and if you're going to preach about it around the world, you have to be good. Now, it's not everybody, but most of the people that are at that level are very good.
Yeah. Or at least very safe.
Yes. Or very safe.
Very good or very safe. Yeah. Yeah. And so getting to this safety, that's kind of the next place I was going to go. Is a lot of what you're mentioning are also revision specialists that you're saying, and the people who lecture and all that. Revision specialists are worn down constantly because their lives are slightly more stressful, because it's not a walk in the clouds and a little wonderland. You're dealing with complications. People have already had complications, more prone to complications. Your whole life becomes fixing complications, and you have no other reality anymore than the world is one big complication, and you're trying to minimize and improve the complications. So I would say how to caution people or lead people into it. If you're going to the revision experts and they're showing you all these revision cases on whatever thing you're doing, you can probably trust them if they're in the revision world. There are people who decide not to do revisions because their practice is so successful. That's a different story. But revision specialists also add another, I'd say, layer of comfort when you're looking at injectables, when you're looking at complicated surgeries like noses and breast recon and all that kind of stuff. Revision specialists are the ones who always tell you this is what you have to watch out for. If somebody tells you there's no risk and nothing ever goes wrong ever, well, I do say that sometimes about some things, but it's like rare. So if they tell you nothing ever goes wrong, what's your complication rate? 0, nothing ever goes wrong.
Run for the hills.
Do you trust that person?
Run for the hills. I do a ton of breast revision, probably more than anything in my practice.
Yeah.
And I scare people. I literally sit with them and say, you have to understand a device like a breast implant is something that is very unpredictable. And sometimes patients don't like that. And they don't want to work with me because I'm so realistic with them. Because like you said, as somebody who does a ton of revisions, you know what to expect. Yeah. It may take time for it to get better. And unfortunately, it's something that a lot of other surgeons paint a very pretty picture.
Yeah.
Like you said, oh no, this is a piece of cake. I'm going to take care of it. I'm going to take that out. Oh, it's going to look beautiful. And then they end up in your chair and they're like, I went to 4 other guys. This is what happened. How can you fix it? So, it's very, very difficult. And it's sometimes, unfortunately, it's difficult to get through to patients and tell them that sometimes some of the stuff isn't even fixable because it's been done so many times.
Right.
They start all over.
Yeah.
In a sense.
Yeah, which does exist. Some things and people should know sometimes you can't fix something, you can just make it a little better.
Exactly.
And what I've seen in my own practice is that as time has gone on, and I haven't become more skeptical, I've just become more realistic with recovery and all the torture I put people through, not explaining to them properly things, that now when you come in to do a consult with me, like you might think it's the end of the world that you're going to die. Because I'm giving I'm giving you warnings, and it could take this long, it could be this long, and I don't dwell on it if it's a 1 in a million chance. I tell the kind of basic things, and then I say, listen, there's other things that can happen in surgery. In the end, just know that anything that happens, I will fix it, and we'll get through it. And the reason my patients don't drive me crazy, and they're happy with me, and they're they are still stressed when they go through little bumps in the road or slow healing. But they're not freaking out because they're like, okay, most of them do remember I said that. And most of them do know when they look up online that everybody said, whatever happened, I fixed it. It's not like I abandon them and run, because I can fix everything I touch, which goes back to what you're saying. Don't go to somebody who can't fix what they did.
Very true. Like you're going to go get liposuction done by somebody who's done 1 year of training. And you get a contour irregularity that they don't know how to do, or God forbid, they put a cannula through your colon. These things are things that are going to be difficult to fix. And then you're going to come back to someone and sit in my chair and say, I went to so-and-so or to this shop that there's 30 of around the country. I don't even know which surgeon operated on me. Well, guys, the one take-home message is go to somebody who does a lot of these, just like Ben's saying right now. If it costs a little bit more, it's worth it because the revision will be twice as expensive. And that's what people don't get. That first operation, I always tell everyone with a breast augmentation, first operation is the most important. You get it right, you're good to go. It's just like the nose, right? Yeah. Because revisions, it doesn't just cost you financially. Your result is going to be more difficult to get. And you've also cost yourself that much of kind of life problems. You go do a nose that they took all the septum and they took basically lower laterals were trimmed down to nothing. And you open this thing up as there's nothing there. You're going to get rib, right? It just becomes so much more complicated. And nobody realizes that the first go around. Until they're a little scared, I guess. Maybe. Yeah, of course. Yeah. So I mean, Kelly Colleen pointed out something interesting. She may have been right on the nose about that one. But yeah, there are people performing aggressive techniques of liposuction that should not be, and should not be sending them to my office on a Sunday for me to try to fix it, even though I'm happy to, but then not take responsibility for anything. So we'll get over that because not the topic of today. But yes, Kelly, somehow I don't know if you heard about that one, but I didn't hear about it. I just scrolled down and saw what she wrote.
Oh yeah, yeah. Whatever. So let's go over fake information and fake photos.
I love it.
Okay. Um, fake
So, fake
information.
news is a big deal these days.
Yes, fake news is like all over the place. So how do plastic surgeons fake news people? Like
So,
what are we tricky at? And we're also, we're victims because we want to make people happy, and sometimes we want to just give them fake shit to make them happy. So we're victims here. But
yes. So it's a combination of a lot of things. So it's simple things of taking pictures in a certain way with a certain garment, a certain way that makes certain things look different, shadows. Look at pictures, guys, and make sure they're exactly the same. They should be in the same lighting. Lighting is very important. Now, I can change the lighting and it could look like I changed somebody's filler. It may look like I fixed their under eyes without touching them. Lighting, incredibly important. The way they're standing, how far away they are. Just simple things like that with pictures. Standardization of pictures is something that we learned in plastic surgery residency. And most of us kind of took home with us. So that's one thing I'd really kind of make sure. The other thing is whether or not half the time they're talking about if they're saying the truth, if the things that are coming out is real. Did they really do this, or was there someone else that did it for them? There's a lot of things that I've heard that surgeons that have other guys. I mean, when I trained in Miami, there were guys from Cuba that were surgeons, but they weren't really technically surgeons in the U.S. They would do half the surgery for the plastic surgeon. The guy would just walk out and be like, "Oh my God, I can't believe what's going on over here."
Yeah.
So, and it's hard to tell, guys. You gotta trust people here and there, but little things like that.
And it's funny because like I always, I see these videos and they're like, oh, okay, well, yeah, so this laser is getting rid of stretch marks. Great. And then like, and this is not a political statement. Nobody say anything. I beg you. It's not a political statement. I'm actually not Democrat. I'm not Republican. I think politics are extremely, extremely corrupt. And I have trouble trusting anybody because I'm just a normal person. But Trump is fucking hilarious. Like Trump will just go like say things that are just not like, it just obviously like you're holding up something next to him and he goes, no, it's not there. And you're like, but it's there. It's in your hand. He's like, no, it's not there. And I keep cracking up every day because I keep thinking about these surgeons and I see their videos the same time because I'm scrolling through my Instagram.
Sure.
And the guy's on Instagram going, and this is getting rid of stretch marks. And they're just doing the laser, but there's no result. And again, it goes back to people using videos and saying something is true. Just because they said it doesn't mean, unfortunately, you can trust them. And I hate to say that because we're doctors and I want everybody to be trusted as a doctor and you should trust a doctor. But Unfortunately, there are some guys who just are slightly, they lose their correct path.
And listen, and it's easy. I'll tell you one thing, guys. It's really easy for me to come up and say, like Ben just said, I have the cure-all for cellulite, for example.
Yeah.
Oh, and I can make
you'll be the
$10
billionaire.
million this year.
Yeah.
It's not going to work. So when somebody comes in my office and asks me that, and I flat out tell them, hey guys, there's nothing out there yet that's really a good cure for cellulite. They're like, well, Dr. So-and-so told me that for $7,000 I can get this done. I'm like, I'm telling you from the goodness of my heart, don't go do it. You're going to waste your money. That's all we can do. Because the problem is not only in the back of the throwaway magazines, but everywhere on the internet, on your Instagram, everywhere else, people are trying to make a buck. Unfortunately, very unethically. And with lasers, all the weird lasers there are out there, and you've done enough of a fellowship where you know how to use lasers better than I do. But we know the limitations. These things they're not magic.
Right.
You know what I mean?
Yeah, and some people sell them as they are. And it's getting trickier because as time goes on, we start to learn how to fool people differently with our newer technology. So people think, okay, well now it's in the digital age and I know better because I can look up stuff online. No, you can get fooled better. People can drown their reviews. People can alter photos with better technology that you can't, see what's going on. They can start using new lighting because like back in the day, it was just like put on a ton of makeup, have someone smile real big. In the after photo, have overhead lighting before, so it's like just shadowing in this direction, and you have all these dark shadows, and then just flash them bright in the face after.
All
and then and people started picking up on that. Okay, but it doesn't mean that doctors are smart, man. Doctors are smart. They find new ways, and they think it's the bad doctors. Some of the best doctors in the world, the most respected, who I'll tell you are not the old school ones, they're the medium kind of younger generation who they get caught up in this. Dude, they're doing flash lighting differences now consistently, and it can only be trickery. I have flash lighting differences because sometimes I took a flash in one room and then I went and took it in the other room before I got to standardize my photo booth.
Right.
But you can tell because there's only like a couple of them. And then you look at the rest, you're like, oh, okay, well, it's a different background. He was sitting somewhere else. Like, I mean, well, I can explain it to people at least.
Absolutely.
No, these are like consistently, every single one is either overhead before, 2 flashes after, or 2 flashes before, 4 after. That's next
crazy.
level.
That's crazy.
But that shows you how smart doctors are. And they'll tell you, well, no, I just, but if 50 photos in a row, it's happening, it's obviously on purpose. It's not by accident.
They want you to name names. We can't name names, guys. We're just chatting and trying to educate everyone. You guys take it from there.
Yeah. If you're hanging out at my house, I'll tell you fucking everything. But if you're not here hanging out, it's
we're having a party at Ben's after quarantine's over.
I have some diplomacy left in me. And I don't sell people out. I'm not a snitch.
And listen, guys, you're right. Karma is a bitch. And these people, one way or another, will kind of reap their repercussions, will come around one way or another. Yeah. But there's no need to name any names.
Yeah. I mean, people find crazy ways to trick the eye. They do. I found, because you know how people used to crank down and then crank up? Now it's trickier. Now they can say, okay, I want you to sit back, do this. I'll take a photo while I tilt the camera. In your after photo, lean forward, stretch forward, still tilt downwards, and I'll also tilt the camera that way. So unless you have what are those whatever angle measuring devices in the
They'll
back,
never tell.
You can't tell. Yeah. So I even look at the background of people to see if it's changed vector, but it has a lot. So there are fake photos, fake that. There's Photoshop.
It's easy. I mean, even with lipo, you can drown out a contour irregularity with a big flash, and it'll look great. And people just don't see that, and it's a shame. I mean, it really is.
Yeah. And here's the lesson of all this. If you look at someone's photos and you look at all their photos, whatever they do, it doesn't matter if you're going to them for a breast lift and you're looking at their knee jobs, you have to go look at their knees, their toes, their head, shoulders. You have to look at everything. Look at everything that person does. If that person has a lot of photos of the things they do, and they're all natural and they're all nice, and the photos make you feel good when you see them, you're not like looking like, is there something all the time? That's who you trust. And that's the easiest person to trust. Now, you're not always going to find that. Some doctors just don't have a lot of photos, which is fine. It doesn't mean they're bad. I'm just giving you the greatest kind of like odds in your favor. And if you see pixelation differences, like we're all good at pixelation now because everybody has these Photoshop things. If you see everything is like super high resolution and you see every dot on someone's face, and all of a sudden when you get next to an incision line, for some reason, it just looks a little blurrier and not as pixelated, that was done on purpose. That's Photoshop. And if somebody's going to Photoshop something, they still might be a good doctor, but you're likely not going to get every bit of truth out of them as you're going through healing or be guided as well. Again, just chances. I see a lot of really good doctors do that stuff, and I'm kind of shocked that they even need to. Everybody knows how to look up reviews.
Ben said something, guys, that honestly you guys got to listen to really big time. And the one thing he said is, if you go to a doctor and they play it off like, oh my God, I'm going to do your nose. You're going to be good in 3 days. You're going to look like Kylie. And guys, things aren't that easy. And your doctor needs to sit down with you and say, these are the possibilities that may go wrong. This is what you can expect. This is what your recovery is going to be like. If anything's done too quick, if anything's in and out too much, if your doctor doesn't have enough time for you, those are the kinds of things, in my opinion, that you really should be a little weary. Maybe, sometimes going to somebody, and I know Ben's super busy, but I guarantee you, he still takes his time and talks to everyone. It's not an assembly line where you get them in and get them out, because it's surgery. And it's important to all of us to really educate our patients.
Yeah, that's why all my patients are upset the first time they see me, is because I'm spent so much time with the person before they don't get it. I get stuck. I talk a lot. So
it's okay. It's better. It's better than not talking enough.
Yeah, I mean, now it's going to be all on FaceTime for the most part for a while, so that'll be okay. The other thing is, now that we're able to meet people and spend time with people on FaceTime even, realize that the consultation is the last thing that you really need to get everything to come together. So you get a sense of the person. This is the most important thing. And there's many reasons for this. Okay. The number one reason I see for, like, you meet somebody and you have to like them, they have to like you, is because as you go through this process, if things heal in 2 days and you never have to see them again, then fantastic. But if you have a surgery that's going to take 3 months to heal, has a chance to be a little prolonged, might have swelling here, might be a little weird, might have some induration in the skin, some hypertrophy of the scar, you better have somebody who you jive with, who you get along with. Because I can be pretty harsh when I talk to my patients sometimes, but they know me and they kind of say, okay, he's being a prick because he already told me this 300 times and he wants me to know that I should stop taking it so seriously. And fortunately, I filtered out my patients where they kind of get that, except for like one person. So, oh God, so everybody else gets it. But a lot of it has to do with how you get along with the person and how they explain things to you. Having somebody there that you, and they don't have to be the nice doctor, just that you understand and you guys agree on things. And because if you go through any kind of tough time, you want it to be with somebody who you can really communicate with and get done what needs to be done, rather than just saying, I hate this doctor, I'm going to go to somebody else now in the middle of your healing, which is the worst time. And then you go to some other doctor and some other doctor says yes. And I always this is what I was talking about the other day, I always trust the people that say no more. Like, because
I agree.
When somebody says no to you, they have nothing to gain other than maybe getting you the hell out of their office if they don't like you. But they have nothing to gain otherwise, other than saying, no, I don't think I can do this. So at least you can trust them. It doesn't mean nobody else can do it.
Absolutely.
But I always trust the people that say no, just to start. And then from there, you can ask the doctor who said no, do you think anybody else might have this expertise?
No, for sure. I had a program director in New York who said, there's going to be that time where it's going to be towards the end of the month. You're going to need some money to pay rent. You're going to need money to pay, to kind of make things meet. And you're going to get that patient that you shouldn't operate on. And you're going to have to say no. He goes, it is more important for you to learn how to say no to somebody, number one, that you don't think that you're going to give a good result to, number one. Yeah. Number two, doesn't have realistic expectations. Or number three, maybe out of your league, something you don't do enough of. And just like you said, it's going to be the best thing you've ever done by saying no, because by saying yes, it may be a bigger headache. And I think that's very important.
Yeah, I've actually had patients that I've said no to because I think the surgery is not a good option for them, but it was kind of on the border. And they said, well, do you think anybody else would do something along these lines that I would like? And I kept thinking, I'm like, well, there is one guy I trust. I don't fully agree with his aesthetic, but he makes people happy. And you're kind of talking about the same thing. And it's out of my ballpark. It's out of my imaginary armamentarium. Like I just can't imagine it. But I say, you know what? You can talk to him. I said no to you, but you can talk to him. If he says yes, then you're good. So I've had those situations where I've said no, but even though I disagree, you can go to somebody else. This is the one to do. Perfect. I've had ones where people have gone and gotten no's from everybody. Then they come to me and I say yes. And they're like, but are you sure? Because I went to 4 or 5 other people. Are you sure? I'm like, dude, look how many I do. Yes, I'm sure. Or I had one the other day and they're like, but I went to this doctor and he said that he trained you and he told me, yes, he could do it. And blah, blah. I'm like, well, yeah. I'm like, I understand that. And it happens. I go, but I've also done like several thousand of these. And I kind of see things a lot of other people don't see. And if you do it, you will have this problem. I was talking about like, tooth prominence with like difficulty closing the mouth. And I'm like, you will have that problem. Just so you know, it will happen. It's not like it's a maybe, it's a certainty. Oh, but why didn't those other I'm like, sometimes, you go to doctors who are very good, but then all of a sudden you meet one who just happens to be better. And I don't want to sound arrogant, but that's kind of what happened. So I'm like,
that's fine. There's absolutely nothing wrong with that.
Yeah. I'm like, that's just what happened. But again, I always trust the no's. I'm always like, you went to that doctor, like, oh, this doctor said no. I'm like, that's a very good doctor. You listen to the right thing. What about so let's say we're getting out of board certification. Let's get into just quickly the doctor versus nurse debate for injectables. Most of the bad filler I've seen, like in under eyes and those areas, is just happens to be from nurses in general, because I think a lot of the MDs just do less volume of injections. Most of the real big complications I've seen have actually come from doctors. So I think that leads us in a position where when you get to injectables, it means nothing. It could be the doctor is better, the nurse is better. There's certain scenarios where I say, yes, for under eyes, I would rather go to somebody who does a lot of lower eyelid surgery or has done and is good at injectables. Or for noses, that knows the nose anatomy, they're a plastic surgeon, and they've also done injectables. Like there's a nice combination where they've seen it physically versus somebody who hasn't. But otherwise, like I've seen kind of all over the place. I don't know how to guide people other than saying, look at their results. If they, again, have a lot of photos and whatever they do and they have a good accreditation and they're part of a good clinic, you're pretty safe doing it. Do you have any opinion on doctors versus nurses for injections?
I think everything you said I agree with, but I also think that people that do it more are better.
Yeah.
This is not one of those things where, although you do have to know how to take care of complications, and I've been called a few times by nurses and a couple of other doctors
Yeah.
when there's been some vascular problems, and
Which is fine. Yeah, I think those are acceptable.
and by no means am I the authority, but you read an article, you know how to do it. I mean, it's not the end of the world. I'm very conservative when it comes to filler. I do a ton of fillers and Botox, but it's also in a very conservative manner. I know a lot of other people that love throwing multiple syringes in, and I think it's what you said. I think you have to look to find somebody who has your aesthetics, and make sure, like you're going to vet a plastic surgeon, you vet the injector. The injector has been doing it for a long time. They have a lot of before and after pictures. They're not just like, oh yeah, I've done this before. There's something I talked to you about a while ago, the threads. Just because you can put something somewhere doesn't mean
just because you can do it.
Don't do it. And I'm saying, guys, just because, I could put a little filler under my eyes, but it's like, I just don't care to do it. And sometimes it's better. Less is more. And I think that's just the way I would look at, if I was looking for an injector, that's what I would do. To learn facial anatomy, I think an injector can do that. I don't think they'll ever learn it like Ben knows it. It's not going to happen. He's had way too much training. But if you sit there and study hard enough to inject lips and to inject cheeks and things like that, I don't think it's that difficult. So I think that over time, whether a nurse or a doc or an MD, I think you could be pretty good. I wouldn't go to some random GP and get injected.
No, yeah. You need somebody who's been doing it a lot. And the people I've seen, the people I've seen busy in LA, RNs and nurse practitioners and PAs, are very often busier than doctors at doing this stuff. And they do have, it's less painful when they do it a lot of the time, because even I cause pain sometimes because I'm like, all right, in and out, problem, stab them, and I'm out. Exactly. I do a very, very good job.
Completely agree with you.
But, so I think there's a benefit to both. And the only place that leaves me recommending people is don't take sides as to if a nurse or a doctor is better. They have to show who's better. It doesn't matter. Like, they have to show who's better. And if you want to look like everybody in LA, then go to the person who injects, you have to pick who you want to look like.
Absolutely.
like I've looked at people where I don't agree with the injections, and I'm like, I really don't think this kind of suits you. But for them, they're so happy with it. And they're like, no, it's great. This is, and my friends all did it and I look like them now. And I'm like, okay, well,
how many times have you had someone sitting in your chair that says, come on, one more syringe? And you're like, but I wanted to only put half of that in.
Every injector goes through that struggle where you're like, no.
Less is more always. That's my take home for injectables, guys. Less is more. You can always add more. There's no reason to fill it up to the point where you have to take it out.
I would say for everybody, I think what we have said is a pretty broad kind of analysis to get people going. So I think this is actually a nice video that we'll put up on YouTube to have, as like a permanent podcast where people doing research, they can kind of read through just to figure out how to go through the abyss of this, like, difficult. It's so difficult. And again, it took me training, fellowship, and 2 years into practice until I finally, something snapped and I got it. It's very difficult being somebody who's had zero training, even if you spend a year researching, to figure out who the right perfect doctor is for you. And maybe you'll never find it, actually. Just like getting married. Like, you might get married to somebody who may not have been your soulmate, but you got along just fine and you guys compromised and you made it through. And in the end, you had kids and you stayed married forever. So who cares if you found the best one or not? You found one that suited you. Plastic surgery is like that. But what you don't want to do is go do what I did and date a fucking psychotic narcissist and then almost get, you want somebody to guide you before that. And I don't know why I get on the relationship stuff with this. I guess I'm still tormented, but you really want to have somebody guide you from the beginning. So
he's single.
Yeah. So, but you want to go through this from the beginning so you realize how clueless we all are. Because if I'm saying I was clueless this many years in, and I was getting, you too, man. We're getting the highest grades in high school, highest grades in junior high, artistic on top of that, highest grade. It took me fucking 2 years of full on practice till I really understood it. And so when people say, well, how do I figure it out? I go, well, you got to take your chances at some point. But here's at least the baseline of what you need to look for, and start with the board certification, because again, that at least makes you feel a little safer, and it does make you safer, especially when it comes to complex surgeries.
And if you have a plastic surgeon, for example, like you have someone like Ben, and you've already had a relationship that you've built, but you want to do something that he doesn't do, ask him.
Yeah.
He will give you an excellent recommendation. I think that if you ask a reputable surgeon for recommendations, you're in pretty decent shape, because if you trusted him with your face, and let's say you want to go get your butt done. Well, he's going to send you to somebody that's got the same, that's got the same type of aesthetics, that's got the same type of, reputation. And it's really important. I mean, you brought a great surgeon into practice with you, and it follows in line. I've known him for years. But it's important because now it's your reputation on the line because you're associating yourself to him. It's just like if someone comes to me like John, I trust John with my family if he wanted to operate on him. And other surgeons, if someone wanted to get a lip lift, I send them to you. You know what I mean? It's just, that's to me, some of the best ways to keep people safe is keep them, refer to people that are really good. But the problem is not everybody knows plastic surgeons, and they have to do their own vetting, unfortunately.
Yeah. Well, with John, it's nice. People always say like, they just like looking at him too.
People come in and they're like, I feel uncomfortable. Is he real?
They're like, yeah. So I saw Dr. Danielpour. He's the sweetest guy. And I'm not saying he's not handsome. Like, he's a good looking guy. But have you seen Lakey? This is like what I swear to God, they say it.
I used to walk through the streets of New York City with him. I swear I'm not kidding. Women would walk into poles looking, and bam. And I'd be like, oh my God, John, again? But now he's got 3 kids and a wife, so those days are.
No, but it doesn't mean that people don't drool. The nurses too. The nurses around town too.
Oh my God, we used to take call at a bunch of hospitals in New York. Every time I'd go in there, I'd be like, "Oh, we thought Lakey was coming in." Like a kid on someone, kid would fall and have a cut on their face, and be like, "Where's Dr. Lakey?" Like, are you causing injuries for him to come in?
Well, now that I have Rob coming in, I have to start working out again a little harder. So
there you go. Why is he pretty in shape?
Rob is ripped.
Oh, is he really?
Oh my God, it's ridiculous. Yeah,
come over.
He puts up like Instagram photos on Instagram, but like at the beach, and then he just starts laughing at everybody, like inside. He's such a nice guy; he won't do it outside. He's I love it. Puts it out.
Just come over. We'll just both M-sculpt. We'll sit there for like 3 hours.
Yeah, dude, I really actually want to do M-sculpt really badly.
Come anytime. Right now, the office is closed. You can come do it.
Oh man, yeah, everybody loves that thing.
It's so much fun.
Yeah, I got to do it. I got to do it for the abs.
We'll do it together. We'll get a 6-pack by the summer. Which is
I currently have a Santa pack.
With the way you cook, brother. Ben's cooking.
I need to back off. I've been backing off the past week because like I can't clean the kitchen anymore.
What's for dinner tonight?
It's enough cleaning. Okay, well, funny enough, tonight we actually have a quail, and there's a roast quail and then some shrimp. I've been trying to go a little more on the vegetable side of things. I keep trying, but then like when I think about the centerpiece of things, I always go back to meat somehow. It's kind of in my mind all the time, unfortunately. But and we do have actually all this like amazing avocados that we got from this like Latin market that my friend brought over. So I'm going to do something pretty avocado aggressive.
Well, I want to see the picture when it's done.
We'll see. Yeah, I'll send it to you. I can't post any more food photos. I've stopped because it's like people go on my Instagram right now and they're like, is this a food blog? Is this a cooking blog?
They love it. Look at all these people. They're like, we love his cooking is fire. We love his cooking. I mean, come on. Yeah. Everyone loves your cooking.
Yeah,
it looks good. That's what's nice. It always looks good.
Yeah, I don't have much in terms of supplies, so I kind of work with whatever I have, and then whatever's there is kind of put together.
It's like Top Chef.
Yeah, I still haven't seen that. Yeah, but I do. I can't watch cooking shows. I get like, I don't know. I can't like read recipes or watch cooking shows. I get kind of bored.
See, that's a good cook though.
I think Emerald would have entertained me because he's bam. Like there that was yeah. Is he still alive? He's probably still alive.
I think he's still alive.
I hope so.
Well, enjoy dinner.
All right.
This has been a lot of fun.
Yeah, thanks for teaching everybody with your big brain. It's always nice.
Just hanging with you was fun.
Yeah, I'm gonna hit you up for some M-sculpt for sure.
For sure, brother. Let's hang. You can inject my face and I'll M-sculpt with you.
All right, awesome. So for everybody else, if you want to follow, he's got Dr. Pay, which is DRPAY. Like it's not that kind of pay. It's actually the first 3 letters of his first name. He's not that kind of doctor. He's the good kind. And also Plastics Docs. So PLASTIXDOC.
CS.
Yeah, there you go. Okay.
Thanks, man.